official says they won, it ends when every vote has been counted. Thank you to our clerks, election administrators, poll workers, and other volunteers for all their good work getting this done. This sort of commitment to the common good makes our democracy and our state better. And that's exactly what we need, perhaps now more than ever, a commitment to the common good. Whether that's taking precautions when you're out running essential errands, to keeping others healthy, picking up groceries for a neighbor who might be at higher risk for the virus, or staying home altogether. It's Wisconsin's empathy and compassion that will get us through. And nobody knows that better than the folks working in nonprofit organizations in Wisconsin who have been there every single step of the way throughout this pandemic, answering the call to serve by providing critical and diverse services to Wisconsinites facing significant challenges. That's why yesterday we announced a $10 million grant program funded by federal CARES dollars for organizations that are providing services such as healthcare, housing, shelter, adult education, or other critical services to individuals in the midst of the COVID-19 pandemic. Every Wisconsin worker, student, and family has been impacted by the pandemic in nearly every aspect of their lives. And the economic stability of our nonprofits is key to ensuring that they can continue their good work for people across Wisconsin as the pandemic continues to impact every community. And folks, it is affecting every Wisconsin community. We have statewide community spread. Yesterday was a record-setting day for Wisconsin with 5,771 people testing positive for COVID-19. It's not happening someplace else or to somebody else. It's here, and Wisconsinites in every corner of our state know firsthand the tragedies this virus and this pandemic hold. 71 of Wisconsin's 72 counties have had at least one death from COVID-19, and over the weekend we surpassed 2,000 deaths, with 2,102 deaths as of yesterday. Our hearts and condolences go out to the families across our state who are struggling with the loss of a loved one. We need to not only get back to the basics of fighting this virus, but get back to our shared Wisconsin values. Helping out our neighbors, empathy, compassion, and yes, doing things not because they are easy, but because they are the best for the common good. On Friday, Mayo Clinic Health System urged everyone to take precautions to help stop the healthcare system from being overwhelmed. Dr. Helmers, the regional vice president for Mayo, said, quote, "We are pleading with community members to comply with all recommended precautionary measures to help reduce transmission of the virus among our neighbors, friends, and healthcare workers. We can do this, but we have to do it together," end quote. Obviously, Dr. Helmers is right. We can turn the corner, we can flatten the curve, but we have to do it now, and we have to do it together. So wear a mask, stay home as much as you're able, avoid gatherings of folks outside of your household, and take every precaution to prevent yourself and your loved ones from getting and spreading COVID-19. With that, I will now turn things over to Secretary-Designee Andrea Palm for her update. Andrea?
Thanks, Governor. Good afternoon, everyone, and thanks for joining us today. Since yesterday, we added 5,935 confirmed cases of COVID-19 to our total. Our 7-day average of new cases is 4,839. 1 month ago, that average was 2,400. 2 months ago, it was 767. That's an increase of 531% in just 8 weeks. Today, our total number of confirmed cases stands at 244,002. All 72 of our counties in Wisconsin are at a very high COVID activity level. That is a stark statistic all by itself, but let me explain it further, because even that number isn't enough to paint the full picture of the crisis. To be considered very high, a county needs to reach the case burden threshold of 350 confirmed cases of COVID-19 for every 100,000 residents. And yet many of our counties have a case burden above 1,000 and even 2,000 cases per 100,000. This is what we mean when we say we are in a crisis in this state. In every region of Wisconsin, we have hospitals reporting staffing strain, as well as hospitals reporting that they are at peak census for accepting patients, for their hospital beds, and for their ICU beds. This means that hospitals are at or near capacity and that their options are limited when it comes to the need for more beds and for admissions. Our alternate care facility, our ultimate insurance policy, in the case of our system being overwhelmed, continues to accept new patients transferred from hospitals across the state. We have now lost 2,156 Wisconsinites to the virus. Friends and family, neighbors, coworkers across the state feel this loss, and we keep them in our thoughts. We need to do everything we can to stop the spread and to stop the loss. We need to join together as individuals who care about our communities to stop the spread of COVID-19. Wear a mask if you have to go out. Stay 6 feet apart. Wash your hands frequently. Get your flu shot. And if you need a test, get a test. Isolate if you test positive and call your close contacts to let them know to quarantine and that they should also get tested themselves. Remember, a negative test isn't a ticket to meet up with friends. It is a snapshot in time, and you need to continue to monitor for symptoms because the incubation time for this virus is up to 2 weeks. And stay home. We're all tired of this pandemic, and I know we've been saying it for months now, but we're saying it because it works. Stay home to save lives. It's the safest choice you can make for yourself, your family, your community, and the state of Wisconsin. Thank you.
Thank you, and we'll now take your questions. A reminder to maintain audio quality, to stay muted until it is time to ask your question. And a note today that we have a hard out at 2:15, so please only one question per reporter per outlet so we can accommodate as many of you as possible. And we'll begin this afternoon with Denise Lockwood from Racine County I. Denise?
Thanks for taking my call. What I want to understand is, Governor Evers, what would a nonpartisan policy look like as you work through a lot of the issues of not having the state legislature being part of the solution? What would that look like?
A nonpartisan policy? Yeah. Wear a mask. People, there's a majority of people in the state of Wisconsin, so it is already a nonpartisan policy. We're a bipartisan or multi-partisan state, so we're already there. So requiring everyone to have a face covering would be something that I think would be bipartisan in not only nature, but frankly, making sure that we get this done. We just have to get it done. And so wearing a mask, having a limit on public gatherings, I think the two things that we're working on now are excellent opportunities for a bipartisan support because it already has it.
Thank you, Denise. Now to Katie Anderson from WBAY-TV.